Namaskar. Welcome to Ek Samvad at Ankuran on occasion of World AIDS Day. So we are in conversation with Dr. Major Milind P Bhrushundi on the theme for 2023, which is Let Communities Lead. Doctor is an HIV consultant and director, Central India Institute of Infectious Diseases, Nagpur. It's a pleasure and honor to have you here, sir. Thank you so much for joining us. Welcome to Ek Samvad. A word about Ankuran. This is an initiative for positive social change through self-development. The goal is greater well-being and happiness for all. At Ankuran, we believe that each person is unique and special in some way, that each person can make a difference, that each person leaves an impact, and that's what inspires us to keep going. So World AIDS Day is on December 1st. It was established by the World Health Organization in 1988 to facilitate the exchange of information among national and local governments, international organizations, and individuals. Annual observance of the day is aimed at raising the awareness of the global epidemic of AIDS, that is acquired immunodeficiency disorder syndrome, and the spread of HIV. Although AIDS is not seemingly unstoppable virus it once was, it still killed one person every minute in 2022. World AIDS Day 2023 looks to recognize the vital role of communities in making progress towards ending the problem. In the fight against AIDS, we must empower and trust communities to lead the way. Together we can make a difference. We are delighted to have Dr. Brushundi with us today. He is an ex-medical specialist with the Indian Army, recipient of the Siachen Glacier Medal, Arthur Ashe Fellowship, Weill Cornell Medical School, New York, USA, certificate in HIV medicine, Department of Infectious Diseases, USF Tampa, USA, and CHAART, India. Medical Director and Chief HIV Unit, Lata Mangeshkar Hospital, Nagpur. He's associated with Sarthi and Sanjeevan, Nagpur, and AIDS Society of India. He's an HIV consultant, managed people living with HIV for more than 2 decades. Warm welcome to you, sir. Thank you for joining us.
Jai Hind.
Jai Hind, sir. So we'll come to a very basic question first, which is what is AIDS and how would you explain it to a layperson?
First of all, I thank you very much for choosing this important topic and the theme which you have already picked up, let the communities lead. So that is a very important thing. Now coming to HIV and AIDS, basically there are a lot of misconception about both these terms. HIV is a virus. It is a immune deficiency virus. So it's just a virus which infects the human beings by 4 routes. That HIV is not transmitted by talking to the HIV positive person or by touching him or caring for him. There are 4 routes of transmission of HIV. The first one is because of the unsafe sex with a HIV positive partner. Number 2, it is the mother to child transmission. The mother who is HIV positive can transmit it to the child in her womb. And the third one is those who are using the same needle for IV drug abusers. And the fourth one is blood transfusion.
Okay.
This is what HIV is transmitted to the human beings. AIDS is the terminology which is totally different from HIV. HIV infects the human beings and it only directly affects the CD4 cells. Now, what are the CD4 cells? CD4 cells in the human body are the army of our body. They fight for us with the infections which are targeted at us. So they are being basically the protective force of the human body. And this CD4 count is totally important in HIV. So HIV infects these CD4 cells, which are basically preventing all the infections. So this is what is the HIV and the CD4. But it is not that on the first day, the CD4 count is going to go down. HIV per se doesn't have its own signs and symptoms. So HIV infects a person and tries to bring down the CD4 cells. That is the protection power of our body.
Hmm.
But that takes around 5 to 7 years to decrease it below 200. And after the CD4 count goes down, that is less than 500, 200,
Hmm.
that point the person starts getting infections because the CD4 are no more
Able to
basically
defend.
are protecting us,
Hmm.
and that person gets a lot of infections. So
Hmm.
acquired means जो आया हुआ है,
Hmm.
that is what we have gained.
Hmm.
Immunodeficiency, acquired immunodeficiency, that is the CD4 decreases your immune power,
Hmm.
and because of there is a collection of multiple infections which are coming to you. That is basically what is the immunodeficiency syndrome. And in those infections, we call those infections as opportunistic infections. And
Okay.
what are the opportunistic infections? They are basically infecting us because they got the opportunity
Hmm.
as the CD4 count has decreased,
Yes.
which leads to decrease in your immune power.
Hmm.
And that is the reason they are getting this opportunity. So
Hmm.
there are n number of infections,
Hmm.
right from the tuberculosis up to cryptococcal meningitis and toxoplasmosis and whatnot.
Oh.
So a person with CD4 count less than 200
Hmm.
gets multiple infections, and those groups of infection is known as AIDS.
It,
There is a person who is HIV positive.
hmm.
At the same time, his CD4 count is normal, that is more than 200. So he will
Hmm.
not have any infections, he will not have any problem.
Okay.
But he will transmit that HIV virus to the other person.
Hmm.
That is the problem. And that is 5 to 7 years. So that is
Yeah.
a very long duration. So
Right.
that
Right.
is the infectivity power of this HIV.
Okay.
So it remains silent for 5 to 7 after infection in that particular individual,
Hmm.
and then it gets transmitted. And when the CD4 count is less than 200, you
Hmm.
develop AIDS.
Okay.
Now I think I have cleared these 2 points.
Yes. Absolutely. Absolutely. So, sir, after that period of time, 5 to 7 years, how does somebody, what are the symptoms? What is the presentation? How would you know?
Yeah, I again go back to my CD4. CD4 less than 200, he can
Hmm.
get any infection,
Hmm.
right from the tuberculosis, oral ulcers,
Hmm.
genital ulcers, loose motions,
Hmm.
weight loss, herpes zoster. These are the commonest form of signs and symptoms which we get. If it is
Hmm.
the weight loss more than 10% of the body weight, fever
Hmm.
for more than 1 month, if
Hmm.
there is loose motions continuously for more than 1 month,
Okay.
oral candida, that is what we call oral ulcers,
Hmm.
and tuberculosis, most commonest cause infection that is in India, which
Hmm.
is in the air. So
Hmm.
this most of the HIV positive patient will be having tuberculosis also. So these are basically the signs and symptoms which are most common. The uncommon will be PCP pneumonia, that is in our colloquial language we call as double pneumonia.
Okay.
Then that is one of the most dreaded disease, and
Hmm.
85% of the people die because of PCP pneumonia. Then
Hmm.
it they may have a cryptococcal meningitis, again a very dreaded disease which can lead to death. And
Hmm.
number three is they can have cryptococcal meningitis, toxoplasmosis, PCP, JC virus, and a lot of other infections.
Hmm. Hmm.
But
Hmm.
the most common, which I have already told you, again I repeat, weight loss more
Hmm.
than 10%,
Hmm.
loose motions, fever more than 1 month,
Hmm.
tuberculosis, oral and genital ulcers, multiple skin infections, seborrheic dermatitis, and herpes zoster. These are most common.
Okay. So, now you've told us about the symptoms. Let us assume that somebody is experiencing any one of these. So, what this person is supposed to do? Kya kare?
I before that I will like to tell you one thing, and that
Yes.
is very very important one. Any person
Hmm.
should not go up to this level when all the facilities are available for the testing in India free of cost at all the government centers, right from the taluka place to a medical college. So
Hmm.
any person who is having unsafe sex
Hmm.
and he thinks that he can have HIV,
Hmm.
they should voluntarily go at the stage when they don't have symptoms.
Hmm.
So do the test as early as possible if you think that you are having either unsafe sex or you are IV drug user.
Hmm.
These are the two things. As far as the mother to child is considered,
Yes.
tremendously, I can tell you there is a breakthrough in that. That in
Mm-hmm.
India,
Mm-hmm.
voluntarily we ask all the pregnant mothers to get them HIV tested, and if
All
they
right.
are found to be HIV test positive, they are given medicines so
Mm-hmm.
that that particular mother doesn't give birth to a positive child. And I
Mm-hmm.
can proudly tell you now that
Mm-hmm.
once upon a time when I started my practice around 22 years back,
Mm-hmm.
the transmission of mother to child was around 30%.
Mm-hmm.
Now it has decreased down less than 1%. So
Wow.
that is a really a great achievement of the that is a heart, what we call as highly active antiretroviral therapy of HIV.
Mm-hmm.
The second breakthrough is blood transfusion. Because of the strict action
Mm-hmm.
of the government of India as well as NACO, that is the National AIDS Control Organization,
Mm-hmm.
they have made it compulsorily to do
Mm-hmm.
blood testing for HIV, HBV, and HCV, all the three viruses, in all the bags of the blood transfusion.
All right.
And because of that, HIV transmission through blood has decreased. So now
Mm-hmm.
coming back to your question, if a particular person gets suppose he doesn't do his HIV testing prior,
Mm.
in spite of his having high risk behavior,
Yes.
then if he develops symptoms, then he
Mm-hmm.
should immediately should go to the ICTC, that is Integrated Counseling and Testing Center
Mm-hmm.
of HIV, which is available and which is totally confidential in all the district and
Yes.
taluka places hospital, as well
Mm-hmm.
as the district hospital, as well as even all the medical college and all the government institutions.
All right. All right.
So they should get them tested for HIV.
Okay.
That is the thing which they should do. And if they found to be positive, they are linked to the ART center, that is antiretroviral therapy, that is HIV treatment centers.
Mm-hmm.
So that is what I would always ask each and every person who is positive
Mm-hmm.
to do that.
So while we are discussing this, sir, because we are trying to create awareness, and this is something not everyone talks about. What is the test like? क्या होता है? When you go for a test, what is going to happen?
See, first, there is a counseling part. So it is, I already told you the name is ICTC. It is the Integrated Counseling and Testing Center.
Hmm.
So whenever any HIV person wants his test to be done, it is
Hmm.
voluntarily
Hmm.
and confidentiality is maintained. For that,
Hmm.
there is a pre-test counseling
Hmm.
wherein that person is told about whether the test comes positive, what will happen. If he is negative, what is the things he is supposed to do.
Hmm.
And then the test is done on the
Hmm.
blood. And
Hmm.
this is a very simple test, just taking 2 ml of blood, and they do the test, and the result is available within 4 hours
Okay.
in the government setup and half an hour in the private setup. After the test is either it is there are not only one test done, there are three tests, different tests are done as per the protocol of the World Health Organization as well as National Aid Control Organization. Three different tests are done to confirm that whether he is positive or not. If all the three tests are found to be positive, he is labeled as positive, and his post-test counseling is done,
Okay.
in which he is either told about that the longevity of life and lifestyle
Hmm.
changes, how is
Hmm.
the positive living. So that is a post-test counseling which is done.
Hmm.
It is in my center also we do that, as
Hmm.
well as if he found to be negative,
Hmm.
so definitely he is told about why what he should do so that he is always be negative. Like he
Right.
has come to us because he is having unsafe sex, and that's the reason he has come to me.
Yes.
So I will tell him if he's negative that he should not indulge in these things at all.
Hmm.
And we then tell him about the preventive aspect of the HIV and AIDS. So the post-test counseling is
Hmm.
done for both,
Hmm.
whether he's positive or negative.
So this idea of confidentiality, for example, when you're talking about it, uh, if someone is diagnosed as having AIDS and it is confidential, what is the way of sharing it with the family members or the friends? Because doesn't it spread? Please talk to us about this.
Yeah, very important and nice question. So the thing is, uh, coming back to the question, The law, that is the AIDS law 2017, makes it mandatory for us to do the partner notification. So, if the HIV positive person comes to us, we always ask him to do the testing of his partner.
Okay.
Whether it's a man or woman, whomsoever it is, we ask them to do a partner notification. So we notify their partners and do the test. This is basically that if the partner is negative, this person should not indulge in the unsafe sex with that partner. That is number one. And number two, it is better to do the test of the partner because they are already having sexual relationship. Here I have used partner and not the spouse because I am talking in terms of MSM, that is the homosexuals also. So they also, we ask them if the person is homosexual, then we ask him to do the testing of his partner also. As far as the friends is concerned, that is the question which we ask to the individual whether they want the support of their friends or not. Otherwise, they should not if they don't want to. And it is not mandatory by law. Tell it to their friends.
Yes.
Involvement of the family is a very, very important thing here. Because when we do involve the family members, that particular person gets a lot of support.
Yes.
But the disadvantage is that these family members sometimes can spread the news in the society, which can be detrimental. So we always ask these individuals who are HIV positive and whether they want to tell it to their other family members or not. And this particular thing is in their the ball is in their court whether they want to tell it or not. But as far as the partner is concerned, that is must by law.
Okay. So let us also talk about the stigma, the fact that, most people think it spreads very easily. How does it spread? Does it spread if you talk to somebody, or how does it spread? Talk to us about that.
Yeah. Again, very important thing which is usually asked to me by most of the people who are taking interviewing me. Stigma basically spreads very fast, and in Marathi, whenever a patient comes to me, I always tell them the story of one lady who has come, who was very sort of she was at a higher position in her village, and one person was there with her, and we specifically told that person as well as that lady that this word should not go out. But by the time she reached her village, each and every person in the family as well as in the that particular village was knowing that thing. So stigma and this news, it spreads faster than any light, I'd say. So that is really bad because then what happens is the discrimination.
Yes.
So stigma is really bad, and that is the reason the confidentiality is maintained always.
So how does the virus spread? In the sense, if someone shares food or they share, let's say they
No,
share the
no,
glass or
absolutely not. I have already told you only four things. Number one, I again repeat, unsafe sex. Number two, mother who is positive, mother to child transmission. Number three, IV drug users. And number four, blood transfusion. Apart from that, not a single thing spreads the virus. I have already told, not by touching, not by taking care of them, not by sharing the utensils, not by sharing the clothes, not by sitting together and eating together. Nothing like that spreads it. Not by sneezing. A lot of people ask me,
yes.
वो मच्छर है ना, मच्छर, वो मच्छर मेरे को काटा, वो बाजू में तुम्हारा HIV पॉजिटिव पेशेंट बैठेला था, तो अभी वो मेरे को काटा तो मेरे को HIV हो जाएगा. So if it can spread by machhar or the mosquito, then all इतना इंडिया में mosquitoes है that each and everybody will be positive. So it doesn't spread by these mosquito bites and nothing like that. Absolutely not.
Okay.
So I always say that HIV doesn't spread by all these things, and definitely it doesn't spread by talking nicely to the HIV positive person.
Yes. So once the diagnosis is done, what is the course of treatment? Just tell us briefly about that.
Yeah, as in short, I'll just tell you. Nowadays, the treatment is very simple. There was a time when I started my practice in HIV, 19 to 20 tablets we were prescribing to the person.
Hmm.
Now it has come back straight away to only one single tablet. That
Mhm.
is the combination of tenofovir, lamivudine, and dolutegravir. You should not remember the name, but it is short form is TLD,
Hmm.
and this medicine is available, and it is very robust medicine to curb HIV. And within 3 to 6 months, you can get the viral load under the detection levels.
Hmm.
And its person, if he takes this medicine religiously, it
Hmm.
can definitely, he will have a normal life as well as definitely better quality of life. There is a very simple one tablet a day,
Hmm.
once a day
Hmm.
tablet which is available.
Hmm.
We have come long way when
Hmm.
there was no medicine, when
Hmm.
it was HIV was a death sentence. Then
Yes.
we had drugs which were very costly and the number of tablets were around 19 to 20 per day. From that
Hmm.
era, we have come to this particular 2023 where we give only one tablet to our patient. That's only once a day without much of the side effects. And it is a very robust drug which curbs this HIV. And we get within 3 to 6 months, we get the viral load undetectable. So this happens only if there is a, properly he takes the medicine without fail.
Hmm.
Number two, if he doesn't indulges, if he indulges into drug abuse, tobacco chewing, and alcohol, then this drug will not act on him and he will fail on that. And again, he will develop AIDS. And then we have to switch over to the higher line, which is very costly, at the same time having very lot of side effects.
So, what is the current status of the disease with reference to the population in demographic terms?
Yeah, in demographic term, in if you talk of India, we do have just 2.1 million, that is 21 lakh of positive people. They are living with HIV and AIDS.
Hmm.
HIV is definitely new infections are decreasing.
Hmm.
I remember 20 years back, I used to say 15,000 infections per day. Now we have come down to
Hmm.
3,000 infections per day all
Hmm.
over the world. I'm talking of. So
Hmm.
definitely there is decrease in the incidence and of new infections. But
Hmm.
at the same time, we have to see that what this community led means. Communities are those population where we are, don't have the access for the preventive activities and where the HIV is increasing.
Hmm.
Basically, in the age group of 15 to 24, that is adolescent age group, HIV's incidence is increasing. At the same
Hmm.
time, it is increasing in MSM, that is the men having sex with men, and third one is transgenders.
Hmm.
So here, these are the communities. So
Hmm.
the theme for this year is let this community lead the preventive activities so that we have already achieved a great success in heterosexual sex
Hmm.
as well as in the adult population, but still they are increasing in the heterosexual adolescent age group.
Hmm.
They are increasing in MSM
Hmm.
and in the transgender where we are not able to do the properly targeted intervention projects. So let them now lead the HIV epidemic prevention activities. And that's why the theme is let the communities lead.
Right. So, before we conclude this conversation, is there something you would like to say to the listeners and to the community, society at large?
Yes, definitely. First thing I will like to tell it to the young generation. Yes,
Hmm.
you do have a lot of access to the things which initially were not people having of your age. That
Hmm.
is, you do have Instagram and you are having WhatsApp and total free life. But with
Hmm.
the free life, with your freedom comes the responsibility. So try to avoid unsafe sex.
Hmm.
And for that, the A, B, and C. That is, A is abstinence till marriage.
Hmm.
B, if it is not possible for you, you should be faithful to your partner. So be faithful to your partner. And if these two things are not possible, then C, that is use of condom. So
Hmm.
this is what the message is for the young generation. And for those who are HIV positive people,
Hmm.
the my message is they should take medicines properly. And if they take medicines properly, they can have a absolutely normal life.
Hmm.
Just it is a chronic manageable condition nowadays. And third way, think to the communities as well as the social
Hmm.
platform,
Hmm.
each and every individual matters what you said initially. Here also, I will tell to each and every individual, if you come across HIV positive person, please don't stigmatize him, help him. He is one of you only. Thank you very much.
Thank you, sir. Thank you very much for being on Ek Samvad. I think the conversation we had will be of some use to the listeners, I hope. And this is our effort to spread awareness. I'm so grateful to you for your time, sir. Thank you very much.
Thank you, Jahin.
Jai Hind.